I, for almost 10 years, was a pediatric intensive care unit nurse. I worked with the sickest kids in the state and really grew an appreciation for kids and how resilient they are and how positive they are. My name is Mindy White, and I am a pediatric nurse practitioner. I work in primary care, which means we do well child checks and ill visits, things like ear infections, strep throat, and then also some more complex things that patients come in with. When choosing a pediatrician, I think first off, someone that you trust is important. Obviously, these are your kids. You want the best for them. I have 3 kids with another on the way, and I know as a parent myself how scary it is when your kids are sick and you don't always know what to do. So having someone you can talk with, ask questions with without feeling uncomfortable is something that's important. When I'm seeing a kiddo, I usually like to talk to them. They're my patient, their family's there, but the kid is my patient, the child is. And so I like to interact with them. I like to make it fun and playful, get them involved in their care if they want to listen to their own heart with my stethoscope, or if they want to put gloves on, just making it not so intimidating for little kids. And then for teenagers, we see teenagers by themselves to give them the opportunity to be their own advocate, their own voice as they're kind of going into adulthood. And then we bring the parents in, of course. When kids need treatment for an ill visit, whether it's an antibiotic, a breathing treatment, or if we have to get labs, things like that, I always try to talk with parents through what I'm thinking and why I'm thinking these things. This is what we're going to do. If things are improving, great. If not, I want you to do this next, and just making sure that the parents feel really comfortable with the plan before they're sent off to take care of their child on their own. Outside of work, right now it's a lot of kid activities. My oldest is in sports and we're going through all of that. And then Legos. I love Legos. I live on a farm. And so in the summer, I actually have a garden. And so like vegetables, canning things, that's something I like to do when I have free time. For first-time parents, I guess my best advice would be to go with your gut. I think that's really important and something we as providers really value. You know your kids best, and so if you feel something is off or you're worried, I want to hear your thoughts on what's going on, because I'm only seeing them for 15 minutes, 30 minutes, where you see them all the time. So when you feel something is off and you don't know that you're being taken seriously, making sure you're voicing your concerns and making sure you have a provider who listens to your concern.